it's just common sense that prescription drug companies who are selling insulin today uh, really are robbing the American people and really creating barriers to a life-sustaining drug.
The price of insulin taking center stage in Congress today, and increasingly this is affecting more and more people. In fact, in the state of Minnesota, our Department of Health now estimates that we have just under 9% of the population that has either type 2 or type 1 diabetes. Type 1 diabetes is the kind that requires insulin in order to survive, and this is not cheap either. A typical 10 milliliter bottle of Novolog, which is a very commonly prescribed insulin, is now retailing for about $333 a bottle. That's without insurance. Most people on a pump are typically using about 2 of those bottles every month. So you can see it's not cheap, and it's exactly why Congresswoman Angie Craig is now wanting price caps.
Look, this is not a life-saving, it's life-sustaining.
It's the very argument diabetics have made for years, that the drug they need to live is too expensive. And today, they had advocates on the House floor.
1 in 4 Americans who rely on insulin have been forced to ration or skip their dose, a practice that can be dangerous and even deadly.
The Affordable Insulin Now Act, sponsored by Minnesota Congresswoman Angie Craig, would force any group health plan to not apply any deductible to insulin. In addition, it caps copays to $35 for a 30-day supply. But not every lawmaker agrees.
The proposed capping, price fixing of drugs that the Democrats are promoting would jeopardize cures for people with Alzheimer's, cancers, diabetes. This bill does not bring down the cost. It only shifts the cost.
If anything, the bill highlights the still deep divisions on how to control the price of prescription drugs.
I hope that this continues to build momentum for prescription drug price reforms. I hope this builds momentum across the country to tackle big pharma in other drugs. And, the best way we can tackle this is to close the coverage gap and to continue to make sure that we put competition in front of big pharma.
Now, the bill passed the House earlier tonight with 12 Republican votes. It does have a companion bill in the U.S. Senate. Now, the state of Minnesota also has an emergency insulin program. It's called Alex Law, and that provides a one-time 30-day supply for those who need it. You can apply at mninsulin.org.